Welcome back to Halo Halo. Karaniba here with your daily dose of all things entertaining from Asia to Hollywood and everything in between. With summer here, everyone is looking for ways to look and feel beautiful, which can be a challenge if you suffer from acne and acne scars. But there may be a solution for you thanks to our friends at LDI, the Laser and Dermatology Institute. Joining me today is Dr. Rispler, the founder of LDI Laser and Dermatology Institute of California. Dr. Rispler, thank you so much for joining us today.
Thank you for having me.
Now, first tell me, why do people suffer from acne?
Well, acne is usually a hormonal disorder, although it gets aggravated with a lot of external factors like climate, sometimes some of the diet, the Western-style diet, the heat, the smog, stress, hormones.
And tell me why laser is a great way to solve or fix acne and acne scars.
Well, there's really no good way to fix acne scars in dark-skinned people until we have the laser. So the laser is the treatment of choice and the only treatment we have for 80% of our patients and probably close to 100% of your listeners. For active acne, the best treatment is Accutane, albeit very effective, a lot of side effects, very toxic. So the lasers, combination of lasers, uniquely work as well as Accutane, but instead of making the scars worse like Accutane does, which is one of the side effects, it actually improves the scars while it's getting it better. So we can clear up the acne with one set of lasers and then improve the scars tremendously and safely, underline the word safely, with the new technology we have.
And Doctor, can you tell me a little bit more about the different types of lasers that you offer?
So we have over 30 devices, but for acne specifically, we have the pulse dye laser, which has a photodynamic effect, kills the bacteria and improves the red scars. We have the 1450 diode, which we call the Accutane laser, which actually shrinks down the oil glands, so safe we can even use it for pregnant women. Then we have the long pulse YAG, which helps tighten the pores and also kill the bacteria. We have the Q-YAG laser, which helps with the brown spots, the fractional CO2, which smooths out the deeper scars, and the fractional radio frequency, which helps the acne scars and the finer lines.
Now, is there a downtime? I mean, can you go back to work? Can you?
Well, most of the lasers are non-ablative, which means they penetrate underneath the skin. So it's red for a couple hours, you can go back to work. Some of the newer devices have some social downtime, where for a few days you have to cover with makeup, but you can still go to work. It doesn't hurt. It just may look funny. So most people plan it on a Thursday or Friday where they recoup over the weekend.
And how long does it usually take? How many treatments do you need?
Usually somewhere between 4 to 8 sessions. Even for the worst case, we can improve the acne where it's easily maintainable, which is on easy to use creams, and improve old scars 50%, fresh scars, new red scars 80 to 90%.
Now, does medical insurance cover this?
Well, it should, but it won't, and it doesn't, unfortunately.
But you do offer payment plans, right?
Yeah, so we try to make it affordable, and because we can do, it's a series of treatments, we can do it a la carte or groups of treatments, and we have financing and other help for the indigent patient.
And speaking of payments, can you give us a ballpark of how much it would usually cost?
Well, usually the treatments run $1,500 to $2,500 per treatment, but when we do it in groups, there's significant savings involved.
There's so much frustration with people that have acne because they've tried cleansers, they've tried creams. Tell me about LDI and what sets you apart from that.
Well, for the people that have mild conditions, sometimes the creams have some minimal efficacy. There are prescription creams, too, that have more than minimal efficacy and also some internal antibiotics, but they're only partially effective. So where the laser comes in is where people are at the crossroads where they're contemplating Accutane, worried about the toxicity, want to help the scars, which none of the medicines do, and really want to get their skin crystal clear. So the laser not only clears up the skin better than Accutane, but improves the scars rather than causes scars. And sometimes you can maintain the effect afterwards with some of the creams that weren't effective before.
And then for more information, you actually offer free consultations, is that correct?
Well, because each patient is different. I mean, sometimes we're seeing an adult acne, so in addition to needing the help with acne and acne scars, the patients, especially the female patients, want to get rid of this, wrinkles. The men want to get rid of brown spots. So it's customization. So in order for a patient to actually know what they're getting, we do that and give them sort of a brief overview of what to expect.
Okay, well, thank you so much for your time.
Thank you.
A huge thank you to Dr. Rispler and everyone at the Laser and Dermatology Institute for taking the time to talk to us. That's all the time we have for today. For more on Halo Halo, check us out on YouTube, youtube.com/HaloHaloTV, and have a great rest of the week.